Hello, I'm Dr. Helen PENSANTI, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're discussing Lyme disease, an infection that is often misunderstood and sometimes is missed in diagnosis. It's caused by a bacterium transmitted through the bite of infected ticks, and early detection is key to avoiding long-term complications. Joining me is Dr. Bryn Henderson. We're going to talk facts and myths. Dr. Henderson, can you explain what is Lyme disease?
Lyme disease is an infection, as noted, caused by a bacterium, and it's transmitted to humans through the bite of an infected black-legged tick. Can you imagine? It can affect the skin, joints, heart, and the entire nervous system if not diagnosed and treated early.
Would you believe I had one of those ticks bite me?
Wow.
And I grabbed it and I looked at it and I had it between my fingers and its little legs were going like wiggling. I got so scared. I threw it on the ground to step on it and it jumped back up on me. Seriously, they jump. They not only crawl, they jump. Well, I have had personal experience. I was living in upstate New York where they have a lot of deer. These are deer ticks. And I didn't get Lyme disease, thank God. Now, let us talk about the different types or classification of Lyme disease.
It's often described in three stages. One is early localization, occurring days to weeks after the tick bite, with symptoms like characteristic bullseye rash and flu-like symptoms.
Let's talk about that bullseye rash, because I've seen it in a patient. And to describe it to our audience, it is a round red rash, and in the middle is a darker red. It looks like you have a bow and arrow shooting at a target. We call that a bullseye rash.
That's true. In any event, early dissemination, when the infection starts spreading, it goes to the nervous system and affects the joints and the heart. And later disseminated, months to years later, with more persistent joint pain, neurological problems, or fatigue.
Do we know anything about the underlying risk factors?
I think genetics influences how the immune system responds to the infection, but environmental exposure, such as the time spent in wooded and grassy areas, are a major factor.
Anything about the development in the womb, could that play a role?
Well, I think the truth is yes, because the way our immune and nervous systems respond form very early in life and can influence susceptibility. And how our body reacts to infections like Lyme disease is innate.
So let's talk traditional Chinese medicine. What do they offer?
Well, traditional Chinese medicine views Lyme disease through the lens of wind, dampness, and heat invading the body. It's fascinating. So their treatments aim to restore balance, reduce inflammation, and strengthen the immune system using herbs, acupuncture, and dietary adjustments.
What are the standard of care treatments in Western medicine?
Western medicine begins with antibiotics, usually doxycycline or amoxicillin, and their first line treatments, often for 2 to 4 weeks. In later stages, or neurological involvement is present, you have longer and often intravenous antibiotic therapies. Symptom management, physical therapy, and supportive care are also very important.
And let's talk about your area of expertise, regenerative medicine.
Regenerative cells and exosomes are being explored for their potential to reduce, of course, inflammation. We use peptides today to reduce inflammation. Repair the nerves and joint damage is often done with injections, and we can support the immune recovery with various types of IVs. Certain peptides under study are already enhancing the immune system.
What lifestyle measures can our audience do to help themselves?
Well, here, early detection is key. People should check for ticks on their bodies after they've been outdoors and probably wear protective clothing where there's prevalence of ticks. Tick repellents are also very effective. For those in recovery, however, pacing activities, getting enough sleep, and anti-inflammatory nutrition is key, along with gentle exercise to support healing.
So, what's the real outlook for Lyme's disease? Because we see so many people in a chronic condition.
Well, most patients recover fully, but there is no question delayed diagnosis leads to prolonged symptoms, and the comprehensive care is required, including medical and supportive therapies. Many people improve significantly.
Well, what's your mnemonic for Lyme disease management?
It's the word clear.
C stands for?
Check for ticks after outdoor activity.
L.
Locate and treat early signs.
E.
Early antibiotics for best outcome.
A.
Activity pacing during the recovery.
And R.
Regenerative therapies for chronic effects.
Well, thank you, Dr. Henderson, for helping us better understand Lyme disease. This condition can be challenging, but with awareness, prevention, and timely treatment, the chances for recovery are strong. And to our listeners, if you spend time outdoors, protect yourself from tick bites, and if symptoms appear, seek medical attention right away. So thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen PENSANTI. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.